Hello, good evening everyone. So this is another video on the nervous system in which we'll be just quickly discussing the differences between the sympathetic and the parasympathetic nervous system. Right? In my previous videos, I discussed it in details in the two videos. So if you have gone through those videos, I hope it will be very easy for you to understand the differences. Okay, so I have just noted down the points talking about the situation. Now the sympathetic nervous system, always remember, it starts with S, that means stress. So it is always active whenever there is an emergency crisis. It prepares your body for fear, fight, flight responses, right? Whereas the parasympathetic is active when you are relaxed. So it is basically conserving your energy. It is basically restoring your energy. Coming to the areas where it supplies. What are the physiological effects on them? For example, if we talk about the skin, the sympathetic nervous system constricts the blood vessels of the skin, and it also constricts the blood vessels of the GIT, of the pelvic viscera of the GIT, so that the maximum of blood can be diverted to the brain and the skeletal muscles, right? So if it is constricting the blood vessels of the skin will appear pale. The secretions of the sweat glands are increased, so there is more sweating. The blood vessels are constricted, so there is increase in the blood pressure. There is more blood flow to the skeletal muscles. As I already told you, the blood flow to the GIT and the pelvic viscera is decreased. And what about the sphincters? There are sphincters, the anal sphincter, the urinary sphincters. These sphincters are constricted, they are closed, so there is no micturition and defecation. What about the thoracic viscera? There is increased activity, so that means there is increase in the heart rate and the blood pressure. Talking about the glands, the sympathetic overactivity will decrease the secretion of the glands. That is the reason for a dry mouth when you are nervous. Talking about the pupils are dilated. Now if we just go to the parasympathetic nervous system, it is completely the reverse. What will it do? It will dilate the blood vessels, so enough blood will flow, so the skin appears flushed. No action on sweat glands. Dilate the blood pressure, dilate the blood vessels, so low BP. Then talking about the viscera, it will increase the blood flow to the GIT and the pelvic viscera because it has dilated the blood vessels. So what will happen? There will be a good amount of peristalsis and the sphincters will be open to allow you the micturition and the defecation, right? What about its action on the heart? It will decrease the heart rate and the blood pressure. The glands, it will increase the secretion, and so that there is a good secretory activity of the glands. Regarding the pupils remain constricted. So now the structural differences. What about the preganglionic fiber? So what is the main structure? There is a preganglionic fiber arising from a nucleus. There is a ganglion where it relays, and then there is a postganglionic fiber which goes to the target organ. The preganglionic, talking about the sympathetic first of all, the preganglionic fibers arises from T1 to L2. Therefore, you remember we gave it the name thoracolumbar, T1 to L2. Now, where will its ganglion lie? This is a spinal cord in the vertebral column. Just adjacent to it, there is a sympathetic chain. So, ganglion lies just in that sympathetic chain. So, preganglionic component is very short, whereas a postganglionic, which will arise from those ganglion, it will be very long because it has to reach the target organ of supply. Coming to the parasympathetic. Parasympathetic, other name is craniosacral. So it will be arising from, the preganglionic fibers will be arising from the brainstem nuclei for the 3rd, 7th, 9th, 10th cranial nerves and S2, S3, S4 spinal segments. Craniosacral. Where are the ganglia present? It is completely the reverse. The ganglia for the relay are present close to the peripheral organ. So now the preganglionic component will be very long and the postganglionic component will be very short. So these are the quickly discussed differences between the sympathetic and the parasympathetic. I hope they will help you in writing down your answers and understanding. So if you like my video, kindly press the like icon and share with your colleagues as more as you can. Thank you so much.